And going live.
Good evening, everyone. I'm Bowinn MLA for North Vancouver Lonsdale, and I am here live on behalf of all of my legislative colleagues representing the Vancouver Coastal Health Authority region, from Whistler, the Sunshine Coast, the North Shore, Vancouver, Richmond, and every community in between. Now, before I go on, I would like to acknowledge the territories that we are presenting live from in one of the traditional languages of the territories. So, Hotswal Tanoya, Hothan Squalowin Quins Quachnomia, Nailta Tameok, Yamusquium, Eskahomish, Eslewata, Bowinn Quinsna, Chenkumantomia. So what I said in the language of the Squamish peoples was, hello everyone, and I'm very happy to see all of you here today. I am coming to you from the territories of the Squamish, the Musqueam, and the Tsleil-Waututh peoples. My name is Bowinn, and of course I also want to recognize that many of you are joining from other territories throughout the province as well. Joining me today as co-host is John Yap, MLA for Richmond-Steveston, and with us are special guests Mary Ackenhusen, President and CEO of Vancouver Coastal Health, and Patricia Daly, Medical Health Officer of Vancouver Coastal Health. I want to thank all of the amazing healthcare workers and all of those on the front lines for the incredible work that you are doing every single day to protect our province from COVID-19 and to ensure that British Columbians can continue to receive the essential goods and services that we need. I know that just 15 minutes ago, we had the opportunity to cheer on those essential workers. And thank you to every British Columbian as well, those of you at home tonight, for the sacrifices that you've made so that we can get through this together and flatten the curve. I know, and I know all of us here on this call understand that these are challenging and unprecedented times for a lot of people. From the beginning, our government has been quick to provide people with the latest information on COVID-19. And in fact, our province was among the first to provide daily updates. Today's virtual town hall is another way to help British Columbians bring questions to the people who have been leading the COVID-19 efforts in each of our regions. And we're pleased today that the BC government and Health Minister Adrian Dix has provided us with the opportunity to connect virtually. So now I'm going to be handing this over to my colleague, MLA John Yap, to give us a quick overview of what this town hall will look like tonight.
Thank you, Bowinn. Thanks everyone for joining us tonight. I'm proud that MLAs from all parties and our health authorities have collaborated to ensure that British Columbians will have this opportunity to have their questions answered by our public health leaders. It's my pleasure to introduce to you again, Mary Ackenhusen, CEO of Vancouver Coastal Health Authority, and Dr. Patricia Daly, who's the Chief Medical Officer of Vancouver Coastal Health Authority. Mary and Dr. Daly will be answering your questions. Now I'd like to ask each of them to please introduce yourselves and your role in our health authority.
Okay.
Mary, how about you?
I'll start. Sure. I'm Mary Ackenhusen, and as you said, I'm the President and CEO of Vancouver Coastal, have been for the last 6 years. And Vancouver Coastal, we're 1.2 million people spread across a fairly vast geography that Bowinn described. We go from Richmond to Vancouver, the North Shore, Sea to Sky, Powell River, Sunshine Coast, and Central Coast, Bella Bella, Bella Coola, and the surrounding communities there. COVID-19 is certainly unprecedented, as Bowinn said, and I'm really happy to be a part of this virtual town hall, which is unprecedented in my book. I've never had this opportunity to do this with two MLAs and to reach a broad group of our citizens. So thank you for this opportunity.
And John, I'm Dr. Patricia Daly. I'm the Chief Medical Health Officer at Vancouver Coastal Health. I've worked here for many years. And as the Chief Public Health Physician, my job is to prevent disease and to improve the health of the population. And specifically, managing outbreaks is one of the roles of medical health officers. So the public health response to this outbreak in regions around the province is being led by public health officials, and my team is tracking every case, following up on all contacts, and working with our colleagues in the hospitals and throughout the healthcare system to ensure we have a coordinated response, but also providing support to municipalities, to others within the community as we respond to the outbreak.
Thank you, Dr. Daly. Thank you, Mary. So in advance of this Townhall, we asked British Columbians to submit their questions on COVID-19. MLA Ma and I will ask these questions. We'll take turns reading out your questions, and either Mary or Dr. Daly will answer them. So don't worry if you didn't get a chance to send in your questions in advance. If you're viewing this town hall from the Government of BC Facebook page live, you can submit your questions in the comment section down below, and we'll have a chance to address them. So you can go ahead now and start asking your questions. So MLA Ma will have the first question. So go ahead, Bowinn.
Thank you so much, MLA Yap. So a lot of folks had questions about our province's COVID-19 testing strategy. People such as Leah from Vancouver asks, I know many people have had all of the virus symptoms and have not been tested. When will you start testing more people, and how will that roll out? Dr. Patricia Daly, maybe
Sure.
to answer this question, over to you.
We're very fortunate in BC that we had testing available widely because we developed our own test here in the province. And we actually have a lot of capacity right now in the province through labs throughout, including here in our region. We recently changed our testing guidelines last week, and we communicated that to physicians. We now have opened up testing to anyone who has symptoms of COVID-19. We've advised clinicians that they can test any patient who presents with respiratory symptoms or is concerned that they might have COVID-19. We do not recommend testing for people without symptoms because the test is not reliable in that situation. But right now there is testing available for anyone with symptoms, and people can contact 811 if they would like to find out the nearest testing site to where they live.
Great, I have the next question. But before I ask it of our presenters, I did want to let everyone know that we did get a large number of questions, 130 to be exact, and we'll do our best to get to them as much as we can. Now, if we didn't address your question, please know that these will be addressed outside of this town hall because if you provided your email with your submission, you'll get a response. So, question number 2, Trish from Powell River asks, I have heard many cases in my community where people are sick and it is assumed that they have COVID-19, but don't meet the criteria for testing. Are these presumed cases being tracked? And if yes, why are the numbers not reported?
Well, I think that I'll answer that. There's really 2 questions. First of all, are people not being tested? Testing is available. It's available in Powell River, and it's available in communities around our region. And there was a period of time when we were focusing testing on certain populations of concern. But last week, and this is a strategy that other places have implemented as well, Alberta and others, as we start to bend the curve down, we actually want to enhance availability of testing and make sure that anyone presenting with COVID symptoms is offered a test. So anyone in your community who has particularly fever and new onset of cough or shortness of breath should go for testing, and they can contact 811 wherever they live to find out where to get tested. The numbers of cases, we are reporting the number of cases in every health authority in the province, and BC has been very forthcoming in doing that on a daily basis. We are up to 680 cases in Vancouver Coastal Health, just over 1,600 in the province. We don't report them community by community because some of the numbers are very small. There's 2 reasons why we don't want to report those. One, it might identify people with illness. If we report there's only a few cases in a community and people think, well, I know people who are ill, they must have COVID-19. And secondly, because we know that not every case may have been tested up until now, we don't want people to think, if there's only very small numbers in their community, that they need to stop taking precautions to prevent spread. So we report them certainly by health authority, and we'll do that on a daily basis.
So Dr. Daly, you actually answered my next question, which was from Serge, from folks like Serge from Gibson's. So why don't we move on to back to you, MLA Yap. I know that you have more questions there.
Sure. So Anne from Vancouver asks, how are you tracking contacts? Are all contacts quarantined?
Okay, another public health question. I'm happy to answer that. So when someone gets a positive laboratory test from any of the labs testing in Vancouver, that is reported to my public health team. We are working 7 days a week. We identify the person and we interview them and part of the process of interviewing them is to determine who were their close contacts at the time when they were likely to be infectious. So we do that standard interview, which is the same interview that's done across Canada. And once we identify the contacts, our team will then contact each and every contact. Contacts are advised to be under quarantine, which means to isolate during the 14 days after their last exposure to the case. And during that period, they will have a daily follow-up call from the public health team to see whether they've developed any symptoms of COVID-19. If they do develop symptoms, we can arrange for them to be tested. And they're provided information as well on how they can safely self-isolate in their homes.
Thank you so much. So next we have 2 medical questions about the virus. Tracy from Richmond asks, what is BC's treatment protocol for COVID-19 patients who are self-isolating at home? At what stage or in what condition should they seek medical help, or can they seek medical help or require admission to the hospital?
That's a great question, and I don't mind answering that one too, Mary. That most COVID-19 patients have mild symptoms. About 80% are recovering at home, and actually quite a large number, about 2/3 of our cases in our region have recovered. And there's no specific treatment drug that they take for treatment. The symptoms will resolve. They will get daily follow-up calls from public health to check on them to see if their symptoms are improving or getting worse. So the treatment is really rest, making sure you're eating well, drinking well, avoiding contact with others in the home. And usually after a 10-day period, symptoms will have resolved apart from a bit of chronic cough, and they can be released from isolation. But it's really important that if anyone has worsening symptoms during that time, that they seek medical attention right away, because people can have more severe disease even 5 to 7 days after the onset of their symptoms. So they may have started out with mild disease, but particularly in that 5 to 7 day period, if, for example, you get short of breath, if you get chest pain, you're feeling worse, you should contact 911 to be taken to hospital. If when you're interviewed by public health, we think that your symptoms are worsening, we will also arrange for you to be transported for assessment to hospital. It doesn't mean you'll be admitted, but you need to at least be examined to determine whether or not you require admission to hospital.
Thank you, Doctor. So next question is from Sue in North Vancouver, who asks, does swimming pool chlorination effectively kill COVID-19? And what about sunlight? I'm thinking of people around a pool deck. It would be wonderful if we could open up our outdoor pools, even if we have to limit the number of people that could be in the pool area at that time.
Thanks for that question, John. I'll answer that one too. And we're encouraging people to be outside. And I know people are anxious to be for other things to open up within the community as the curve is flattening. And certainly we'll be providing that advice from public health. Now, regarding the specific question, chlorination will kill the virus. COVID-19 is actually quite sensitive to disinfection. So we've told people that their standard household cleansers, when they wipe down surfaces, will kill the virus. Chlorination in a pool, which is there actually to kill organisms like viruses and bacteria, will kill the virus. The bigger concern in a pool is actually not being in the water. It's people congregating, perhaps in the change rooms or on the deck. And that is one of the reasons why we're not encouraging that at the moment. So when we start to open up some of these services, we'll have to have guidelines in place so that we maintain some of those safety protocols. Regarding sunlight, we actually don't know. I know that some people speculate that perhaps over the summer months, just as we see some other respiratory viruses disappearing, such as influenza, we've seen a real decrease in influenza circulation in the province, and that occurs in the summer months. We don't yet know if that will happen with COVID-19, and I don't think we can assume that will happen. But we certainly still encourage people to be outside because there's other benefits for being outdoors.
Thank you so much. So an individual had a question about large rural areas in the Vancouver Coastal Health Authority region. And of course, you've got both urban and rural areas. And this individual asks, well, I'll just read out the question actually. So Vancouver Coastal Health includes large rural areas, and because of the way the infection numbers are are reported, there is an impression those rural areas are COVID-free, an impression many believe is responsible for people traveling to those areas to escape the risk. Is Vancouver Coastal Health willing to provide more detailed information about the impact of COVID-19 in its rural areas?
Well, I can say that we have had COVID-19 cases in our coastal rural communities. So people should not assume that they're COVID-free in those communities. I will also say that we have testing available in those communities to make sure that we can pick up cases. Whether or not people are traveling to escape COVID-19, we actually think that the population has really followed the guidance from public health very well. We're not seeing a lot of travel around the province. There may be some people who need to travel. We've asked people to not travel for non-essential reasons. There may be people who have to get to homes. They may actually live in some rural communities and work in urban centers. But by and large, we don't think people are traveling to escape COVID-19 in urban centers. But please don't assume that there is not a risk in rural communities. There certainly have been cases in our coastal rural communities.
Thank you, Doctor. So the next question is as follows. This pandemic is understandably very challenging for people in BC. People are looking for safe ways to tend to their well-being in the beautiful backyard that our province has to offer. So folks like David from West Vancouver asks, we have heard that this is not the time to load up the Winnebago and take off for the weekend. I'm just wondering, what about boating? I'm thinking one could be anchored in a little bay and not really have contact with others.
Well,
Sounds idyllic. We don't like to do that, right, Patty?
Yeah. I would say that I've been encouraging people to be outdoors, that we have not asked people to be confined to their homes. People need to get outdoors for physical activity, for mental and physical well-being. And there are ways that you can do that. I've encouraged parks to remain open so people can be out for walks, out with their children, as families. And if you have an outdoor activity where you can go out and not risk exposing others or being in congregate group settings, I think that's fine. So if you have a boat, you take your supplies on there, you go out, you anchor offshore, that poses no risk to anyone. And it's just another way that you can be out to enjoy the outdoors, which we would encourage.
All right, so this is an interesting question, and apparently it's been asked a few times. As social animals, our human tendency, of course, is to be with other people, which has been very challenging during these times. Now, those of us with family who live at home, with neighbors, that you can talk to over the fence at a safe distance, we're very fortunate. But what about people who live alone? And they're wondering, what is the guidance for physical distancing for people who really are on their own? Can they designate one other person who also lives alone to be an extended member of their household, for instance? What's your advice on that?
Well, first of all, our guidance is around social distancing is not a rule. We know families, for example, if you're living in the same household, parents with children, they're going to be together. Oh, I do have concerns about people living alone. I think it's a very good question because we know that social isolation can actually lead to poor health outcomes, particularly for older people. And actually, when we're following up people who have COVID-19, if they live alone, we do ask them if they have an emergency contact, someone who can check on them. It doesn't mean they have to be living in the household with them. It could be calling them. It could be visiting from a distance. So we do want people, if they live alone, to think about who their emergency contact is, someone they can at least be in touch with, whether it's virtually or by the phone, to check on them and make sure they're okay, they have the things that they need. And you can do that while still maintaining physical distancing. One of the things we've also advised people, they may have elderly neighbors they're particularly concerned about. And elderly people, of course, can have more severe disease if they're exposed to COVID. So we're not recommending visits to elderly people from younger people who may be ill and not even realize it may be in that very early stage. But certainly checking on your elderly neighbors through phone calls or virtually is a very good idea.
Good, thank you. So our next question, a similar one, is from Morgan in Vancouver, who asks, in other countries such as Australia, there are clearer guidelines about whether couples who do not live together can visit each other to provide emotional support. Are there guidelines for BC about couples who are in separate households being able to visit each other?
We haven't gotten that specific in our guidelines. I think that there are couples who are going to be spending time together, whether you live in the same household intermittently or all the time. Same with parents and young children. So we're not suggesting that you need to stay 2 meters away at all times if you're healthy from your loved ones. That's not guidance that we have given. And if you're a member of a couple, I think that we need to be reasonable and practical in the advice that we give. I think if one of the members of the couple were to become sick, we would then provide appropriate guidance about how they can avoid exposing the other member of that couple.
So, well, we've been social distancing for a long time now, and British Columbians have made a lot of sacrifices to bend the curve. And I know that we're always looking towards the future, and certainly British Columbians are looking towards the future now. And so folks like Rachel from Vancouver will often ask, well, to help us know what to expect and have some kind of option for planning whenever physical distancing rules are reduced, what will that look like? And what do you think will be okay again? And what sort of rules can we expect to remain for the near future?
Mm-hmm. That's a good question. And first of all, I want to thank everybody, because the work that the population has done by washing their hands, by physical distancing, by staying home with their sick, that's why we've been able to bend the curve. And we've been quite successful in doing so across British Columbia. And now we are starting to plan for how we start to lift some of the public health orders and other guidelines we have in place. In fact, there are very few actual orders that we've got in place. We have an order against mass gatherings of 50 people. We've ordered personal service establishments closed, like spas, hairdressers, and others. We've ordered bars closed. We've ordered restaurants not to have in-restaurant dining, and there's some rules for returning travelers. But most of what the social distancing has been a recommendation that we've advised the public to follow. As we start to think about carefully lifting that, and we will be doing it carefully because we don't want to see a large rebound in cases. The virus is still here in our province, although it's at lower levels. So it will happen gradually and not all at once. And I think we will try and focus on areas that we think are going to be most beneficial to the population without risking large increases in cases. So that's something we are talking about as public health officials. And I would encourage the public, as we start to make those recommendations available, to follow the guidance. I think there will be some restrictions that we will have in place going forward, especially to protect our vulnerable populations. And that would be residents of long-term care facilities and assisted living facilities who have been very hard hit by the virus. Some of our other vulnerable populations, for example, people who are homeless or have unstable housing, people who have other chronic health conditions. So there will be guidance in place to protect those populations, even as we lift the other restrictions.
So what about people who already have had COVID-19? Melanie from Richmond would like to know, do you foresee restrictions on social distancing being lifted first for recovered individuals?
So that's a very good question. We're learning more about recovered people. People may have heard about a new blood test that can test whether or not you have antibodies to the COVID-19 virus and whether or not this indicates that you're now immune, which means you've recovered and you can't be reinfected. We're in the process of validating one of those tests here in British Columbia. And once we have that information, we will decide how we will use that. We haven't so far suggested that the evidence shows that that you'll have long-term, lifelong protection once you've had it once, but we are learning more each day from some of the research underway. And I think you will find more guidance once we have the results of some of those tests of this new antibody test.
Right. So we have another social distance question here from Patricia. She lives in Vancouver. The question is, if the purpose of social distancing, or physical distancing, as we now often call it as well, is to flatten the curve to avoid overwhelming the healthcare system, why has the focus now seemed to have shifted to eliminating any COVID infection in the province? She further goes to state that we don't shut down society for the flu, as an example. Patricia works in healthcare, and they say that our hospitals are empty due to canceled elective surgeries and very few COVID-19 cases. Do you have any thoughts on that?
Well, I might let Mary talk about the hospitals, but just let me say that our goal is not complete elimination of the virus. It has been to flatten the curve. we're going to start lifting restrictions, but we anticipate the virus will still be circulating at low levels. So the goal was always to make sure we don't overwhelm the healthcare system and we reduce the severe cases and deaths. But maybe I'll let Mary talk about the healthcare system.
Yeah, so your writer is absolutely right. Our hospitals are working at lower levels than they have for quite a long time. When we first started seeing our cases creep up the curve, and we first started getting hospitalized patients, that's when we made that very important decision across the province that we needed to maximize the capacity in our hospitals so that if we were one of the unlucky countries or provinces that hit the Hubei or the Italian curve or the New York, where we had this just devastating peak of the curve, that we would be ready for that and we could do our very best in terms of caring for the population. So a big part of creating capacity was to reduce our surgical slates. So while we continue to do urgent surgery and emergent surgery, all that, the urgent stuff happens, all the elective surgery slates were put on hold until we could see where our peak was and get ourselves past that peak, which of course we hear now we are past that peak. We're in a very good position. And so that's why we're now looking at reopening on a measured basis our surgical program and bringing that back because we know now that we don't need those extra beds. We don't need those extra nurses that would have been caring for COVID patients. We're in a good place. And now we need to think carefully about how we bring those services back up, which we are doing as we speak.
That's good. Good segue to this next question, which is from Dina from North Vancouver, who asks, with the numbers of hospital beds occupied by COVID-19 patients being held to a fairly constant minimum and those in ICU trending downwards over the last few days, will our provincial health minister commit to admitting virus patients from long-term care homes to hospital, thus minimizing exposure of others to the virus and stopping the spread?
Yeah, that's an excellent question. I'm actually going to let Patty answer that one because we've tried it a couple different ways, trying to see what's the best formula to stop the spread. And so I'll let you answer that one, Patty.
Sure. So first of all, patients from long-term care can be admitted to an acute care hospital with or without COVID-19, but if they need hospital care. So there's nothing preventing that admission from occurring. Some of it has to do with the care goals of the individual patients and their family. One of the things we have tried, because we've been quite concerned about outbreaks in long-term care, most of the deaths in our province and actually across Canada have occurred among residents of long-term care for whom the disease can be quite severe. And we actually had the first long-term care outbreak in Canada within our health authority. We've tried a number of strategies to try and reduce the spread. We've actually implemented a number of things that have now been adopted not only across the province, but across Canada to try and prevent the spread. We now have all of our long-term care staff wearing masks and other equipment to protect the residents from being exposed to the virus inadvertently. We're restricting staff to work at a single long-term care site so they don't move between sites. And we provided a lot of resources to long-term care facilities to help prevent spread if an outbreak is declared. One of the things we've also tried is if we're doing as much as we can to identify outbreaks early in long-term care. If we get a single case in a resident in long-term care, we have tried moving that resident out of the facility into an acute care hospital or other space to try and prevent exposing other residents. We've got one situation where that seems to have worked. It hasn't always worked. And what we've realized is if the outbreak is not identified at a very early stage with the first either resident case or staff case, it can be hard to control the spread. So we'll continue to do that. We continue to evaluate each long-term care outbreak, and we had one declared over just today. If we get any new outbreaks, we may also decide it's best to try and move the resident out of the facility. But for some with ongoing outbreaks, that's not the best approach, and we'll continue all the other measures that we have in place to try and prevent spread.
All right. Well, Mary, you mentioned earlier about the elective surgeries. And I remember that the Premier, Minister Dix, and Dr. Bonnie Henry had shared that the decision to cancel elective and non-urgent surgeries was one of the most difficult measures that they had to take to prepare our hospitals during this pandemic. And this has had a profound impact on many people who have been waiting for those surgeries because as many people know, elective and non-urgent surgeries doesn't mean that they're not medically necessary. So Danielle from Squamish would like to know more about the plan to address canceled surgeries. Can you provide a little bit more detail about it, especially as many wait lists are already months to years long?
Yeah, well, we're in the planning stages right now, trying to do exactly what I think she would like to see in terms of understanding which wait lists are the most urgent of our non-urgent elective, because while we call it elective surgery, obviously it's people in pain quite often and that are deteriorating potentially if they're not getting their surgery in time. So we're trying to be very smart about it because we can't bring it all up at once. There's constraints both in terms of resources as well as protective equipment. But what is the most important part based on where the wait lists are perhaps the longest, or where the people who are on the wait list are suffering the most? So I don't have a direct answer on that. The timelines that I think that were given provincially are somewhere between mid-May to the end of May is when we hope to start bringing those surgeries back up. And so we'll let folks know more when we know more about that.
Thank you.
So next question is in regards to the population living in the downtown east side, as well as the people who are supporting them. Organizations in the downtown east side seem to be currently taking different levels of precautions. Some residential alcohol and drug recovery programs are in lockdown to protect residents and staff, while others are still allowing residents to go freely in and out of the facility and into the community. What is your perspective on what would be the best approach for this vulnerable population?
Well, I can answer that. And thanks for that question, because that's a population we are concerned about. We haven't seen outbreaks of COVID-19 in our downtown east side population. So we've been working hard to prepare. We're doing a lot of testing in the downtown east side. And we think we have a good plan in place if we were to start to see spread. But as for the residents, no one is locked into their residence, whether you live in the downtown east side or elsewhere. People can still go out. People have their needs. They need to go out for food, for other reasons. So we're not suggesting people need to be locked down wherever they live, whether it's in the downtown east side or elsewhere. Instead, our strategy is focusing on making sure broad testing is available in the downtown east side. If we do identify cases, if they're people who are homeless or don't have a stable housing environment, we have a place where they can, if they're not sick enough to go into hospital, where they can recover. We've been working with BC Housing in the city of Vancouver. We have a hotel identified where they can recover with good support. And even for people who might have been exposed, we have places where they can go if they don't have stable housing. We've also worked hard to make sure that the shelters are more spaced out. There's some new shelter space now open in the downtown east side. We're working with many of the providers in the supportive housing units down there to do active surveillance for cases, but nobody is confined to their room. They can still go out as they need to for their daily activities.
So Rosalie from Vancouver asks this question. Will BC move towards supporting the development of herd immunity as a strategy for moving past this catastrophe? And maybe in your response, you can explain for our viewers a little bit about what herd immunity is as well.
Sure, this is a great question. So herd immunity is when you have a high enough percent of the population that's immune to something that it can stop a spread, even if not everyone is immune. And the example we often use is around immunization. So people may recall in recent years some measles outbreaks in BC and elsewhere. Measles is one of the most contagious of all viruses. And we know that if we can vaccinate enough people against measles, and we get, let's say, 95% of the population vaccinated, then that provides what we call herd immunity. And it's enough to prevent transmission to people who maybe can't get vaccinated, such as people who might have compromised immune systems. So the fact that you have enough people immune means it won't spread in the population, even to the small number of people who aren't protected. So this question has come up. People have said, well, maybe we should just open everything up, let adults get infected and create that herd immunity. The problem with that strategy, of course, is a percentage of those people will get very severe disease, end up in hospitals, ICUs, even dying. Mary alluded to some of the very severe outbreaks in some other communities. So that is not an appropriate strategy. And I can tell you that our public health planning, as the curve is flattened, to lift certain public health measures doesn't depend on herd immunity. We think we can safely lift those, some of the measures in place, continue to monitor without that herd immunity being in place. Ultimately, of course, we do hope there will be a vaccine against COVID-19, and that will create that kind of immunity, but we're not going to do it by trying to encourage people to get sick with COVID-19.
So that brings us to our live questions now. We've completed the questions that were sent in advance. So the very first live question is as follows. Can we address home care providers? We are actually caregivers taking care of people with disabilities in our home 24/7. We would like emergency beds in case we are sick and PPE.
Mm-hmm.
So I think when we say home care provider, we probably mean home support providers. I'm going to interpret it that way. We do have a provincial framework which speaks very clearly as to how we use our PPE, which is personal protection equipment. For those who aren't aware of the acronym, what we use quite frequently. And so personal protection equipment would be that mask over your face and nose. It would be some type of protection for your eyes, gloves, and perhaps a gown. And so for anyone that is doing direct patient care, whether they're in a hospital or in a long-term care facility or a home support worker going into the home, they are provided with PPE, with the protection for their eyes, the mask, and the gloves minimally, and a gown if necessary. So these home care providers, home support providers are provided with that equipment. And if this is someone in Vancouver Coastal Health that isn't getting their equipment, then certainly let your supervisor know, because we absolutely have equipment that we want to bring to you immediately.
Okay. You two are doing great. Thank you so much for answering these questions. We have another live question, and I've just got to find it now. So we've got one from Maria, who asks, how can a partner self-isolate in a home with a vulnerable person if they have COVID and don't want the vulnerable person to fall ill? And she also notes that they live in a very small home. Do you have any advice for her?
Well, first let me say, I can answer it, that I mentioned that we follow up every single case of COVID-19. And one of the things we do is we try and make sure that that case can safely self-isolate without risking exposing others, particularly vulnerable people who might be in the household. And although COVID-19 can be transmitted in a household setting, we've had many cases where we've been able to prevent spread to other household members. But if the living situation is precarious or there might be people at risk, we would then adapt the strategy, perhaps find somewhere else for the person to self-isolate or find other ways of trying to protect those vulnerable people. So we would assess this on a case-by-case basis if anyone does become ill, and we're following them up from our public health team.
But I will say, as Patty has taught myself and the whole team of leaders at Vancouver Coastal, the very most important thing to do as frequently as you can is washing your hands for 20 minutes, soap and water all the time. And Patty underlines that for us, and it has really taken root, certainly with myself, my family, and I think all of our leaders. We're always washing our hands, and it does make a big difference, I think.
Thank you for that, Mary. And I know you meant 20 seconds and not 20 minutes.
I'd never get my work done with 20 minutes, would
20
I?
minutes would be awesome. Okay.
I think we'd have a run on hand lotion.
Yeah, for sure.
And so the next live question is from Marlies, and she asks, should people with asthma get tested either way?
I think people with certain underlying health conditions like asthma are concerned that they could get more severe disease if they get COVID-19. But we still do not recommend that people who don't have any symptoms require testing, because the test is actually not reliable. But I would say that if you do get any signs of fever, even if you don't have a thermometer, if you start to feel chills, if you get a cough, or if you have asthma or other respiratory conditions, you might have a chronic cough. If that cough seems to be getting worse, or if you even get other mild symptoms of a respiratory infection, whether it's a sore throat or runny nose, yes, then please call 811, find your nearest testing site and get tested.
So we have another live question from Mike, who asks, my annual cancer checkup is due soon. I have phoned, but only have only been allowed to leave a message, will I be able to have the checkup?
Well, I think we, and Mary can talk about this too, we do know, as we've talked about plans to open up surgery, we know that there are many other healthcare services we need to start making available, whether it's clinics in the community where people with chronic conditions or people with cancer or other conditions may need to be assessed, or elsewhere. One of the things that's happened as we've dealt with the COVID outbreak is that a lot of care has been provided virtually by physicians. So that's by phone or by other means. But we do need to think about how we're going to be able to not only ramp up, for example, elective surgery in a thoughtful way, but make sure some of those other clinical services are now available, particularly for people with serious health conditions. So that planning is also underway.
Yeah, I would guess, I mean, I think most of the health authorities do have processes in place. So if a message is left, then hopefully he will get a response back. I would also use this opportunity to remind people that, if they have an urgent need, they shouldn't be afraid to come to the emergency room. So we have seen certainly a large drop in our emergency room visits, which in some sense is a blessing because sometimes they can be overwhelming. But the emergency room is there. The emergency room is safe. And anybody that needs that type of care should not have any fear for coming into our emergency rooms. They're safe and they're there for you.
That's good reassurance. Thank you, Mary. So the next live question is from Michael, and he asks a question that's on the minds of a lot of people as a simple one, and it's this: do we need to wear masks?
Yeah.
Patty's favorite.
My favorite question. And I think, perhaps there's some confusion because of what our neighbors did to the south in the United States. None of the chief medical health officers across Canada are recommending that the public wear masks. They certainly shouldn't be wearing the masks that we need for our healthcare practitioners. We need to preserve those masks for providing care, as Mary has described. But what about people who may choose to wear, for example, a homemade or cloth mask? We recently said, we put out a statement that is permissive of that based on similar guidance in the US. In some places in the US, they're recommending it. But one of my concerns is that people misunderstand why, even in the US, they're making that recommendation. And we don't want people to wear masks and stop doing the other important things, such as hand washing, staying home if you're sick. If you put on a mask, it doesn't actually protect you from becoming infected. That's not the reason why some places in the United States, they're recommending people wear homemade masks. A homemade mask can prevent you, if you have an infection, from exposing others. So it's very similar to the advice we have about coughing into your elbow. Wearing a mask all the time is simply like coughing into your elbow. If you produce droplets, they won't spread into the environment. But there are some concerns even with you wearing a mask. First of all, we don't want people to think, oh, I'm sick, I can wear a cloth mask and I can go out. No, if you're sick, you should be staying home to avoid exposing others. You should still remember hand washing and your social distancing. And people who use masks need to be very careful taking them on and off so they don't contaminate themselves, and wash their hands afterwards. So if you choose to wear a mask when you go out, remember, it's about preventing exposing others. It doesn't necessarily reduce your own risk of being infected, and you need to still take all the other measures that we've advised.
So it kind of sounds like people can choose to wear homemade masks, but they shouldn't be overconfident that they stop washing their hands and stop physically distancing and stop avoiding to touch their face and so forth.
That's right. And I've said to people, I don't wear a mask when I'm out in the community, going to the grocery store and other places. I practice all the other advice that we've talked about, my hand washing, my social distancing, and I don't wear a cloth mask when I go out.
Great. So here's jumping a little bit over to the next question from Mary. She asks, are there any supports for COVID-19 sufferers at home?
Mm-hmm.
And maybe I would hazard to guess that she might be speaking also about, people who display COVID-19 symptoms, but maybe did not get tested under the old testing regime.
Yeah, it's a good question.
I was thinking also that, there is one of the fears, the unintended consequences with lots of social isolation is, if you're prone to mental illness, sometimes that can aggravate and create more anxiety, more depression, more various. And we have still, even though we're working in a different methodology with our community mental health services, we still have the ability for any of our clients or new clients to connect in with our mental health teams. The visit might be telephone, it might be virtual, though if needed, there is the opportunity for face-to-face. I was just connecting with the Lionsgate group around that yesterday, and the Hope Center. And so I know that they're in full activity, really working to make sure that those who are isolated have the mental health supports that they require.
Yeah, people should not be suffering alone. If you have symptoms and you haven't been tested, I mentioned contact 811. They can certainly provide you advice. They can talk to you about whether you should get tested. If you do test positive, you will be contacted by my public health team on a daily basis, not just to see how your illness is progressing, but to ask some of those questions if there are other things people need and other services that we can help you access while you're at home.
Okay, our next live question is from Joni. And Joni asks, when my surgery is rescheduled, will I be required to get tested for COVID-19 prior to my admission?
It's a big debate, but if you do not have symptoms, no, you should not require a test. And while all the acute care workers will be wearing masks so that they can't infect you as a patient, there is no requirement if you have no symptoms that you need to be tested before your surgery.
Great.
Is that right, Patricia?
That's exactly right. That's
okay,
right.
I got it.
Another testing question for you too. Ralph asks that many report symptoms of loss of smell and taste, and they have the virus and are contagious. Why don't we test for those symptoms here in BC?
Well, in fact, if you look at the latest bulletin we sent to physicians about testing in Vancouver Coastal, we list a whole list of symptoms that we now know can be associated with COVID-19 as a trigger, especially for certain populations where we want people to really proactively test, such as residents of long-term care or vulnerable populations. And loss of smell is one of the symptoms that we now know from the literature has been associated with COVID-19 infection. So that is on the list. The very typical symptoms that most people will get with COVID are the fever and new onset of cough, sometimes shortness of breath, but there are a whole other host of more subtle symptoms, particularly in certain populations like frail elderly people in long-term care, and we provided that whole list to doctors, and loss of sense of smell is one of those symptoms on that list.
So the testing criteria has really expanded in recent days then.
That's right. This information has only gone out within the last week, so some of the questions people may not realize that, and I think we're going to even find more guidance over the next coming days, encouraging physicians who may still be thinking they need to restrict testing. No, we want you to test anyone who presents with symptoms. And we also want you, however, we also want to remind you there are certain populations where we really want you to think about testing anyone with any symptoms, some of those more high-risk populations like long-term care residents, people who are homeless. We're concerned about people living in certain congregate group settings where there may be a greater risk of a cluster or outbreak occurring. We're trying to make sure we have enough testing in remote and rural communities. We actually think we're doing quite well there, but we can't forget that. Indigenous communities. Those are some priority populations we want to make sure get testing, but really anyone now, if you have symptoms, any British Columbian, anyone in our health authority, the typical symptoms being fever and cough, but even though it's some of those more subtle symptoms, call 811, they'll advise you where you can go to get tested.
Great, our next live question is from Jane, and her question is, our seniors complex have been getting together outside, sitting at least 6 feet apart in a circle, and it's been really good for morale. Is this safe practice? Approximately 10 people.
I think that's great.
I like the health officer, but I think it sounds good.
It does sound good. I would say that's great. And we're getting lots of people contacting us for advice about how they can be outdoors safely without risking exposing themselves or others. And this is a great example of that. People who find a way to socialize. You talked about, Bowinn, about people talking over their fence to their neighbor, staying 2 meters apart. So I think this is great. Being outdoors, physically apart. Remember to wash your hands when you come in, because it's not just about that physical distancing. If you touch surfaces, like chairs that you don't touch your face, go inside, wash your hands when you're done. But yes, people need social interaction. They need to be outdoors. And I think that's a great way they can do it whilst keeping themselves safe.
So we have one from Brent, and I'll just read it word for word. He says, I'm confused. Do I only have to stay home if I'm sick, or am I to stay home and only do essential things? I think that's a question that a lot of people often have.
Yeah, we've never said people need to stay inside. We've never had what we call a shelter in place order. We have advised people they shouldn't travel except for essential reasons. But we still didn't always encourage people to go outdoors to get physical activity. But if you're going to places, congregate settings, that's where you might risk perhaps touching contaminated surfaces or other places. Now, there are lots of people who have to go to work, not just healthcare workers. We've encouraged daycares to stay open. There are essential service workers throughout our community in our grocery stores, providing us with food, many other essential services. They're out going to work. So we've never said people should stay home. We've said reduce your social interaction, don't travel unnecessarily, but it's never that people have to stay indoors.
So to clarify the question though, if they are sick, are they still?
Yes.
Then it's different.
If you are sick, it is different. So we have said to people who are sick, you should not be going out. And that's what one of our concerns about people thinking, oh, maybe if I wear a mask, I can go out if I'm sick. If you're sick, you should, first of all, if you think you have COVID-19 symptoms, contact 811, get tested, but then you should be staying indoors. People who actually have COVID or are sick, we do want them to isolate indoors until they're no longer considered contagious to others. And your public health team that follows you will advise you when you can go back outside.
Great. So our next live question, probably our last one, given the time, is as follows. Jennifer asks, going forward, is social distancing something that will or could be implemented in a recreation YMCA environment once they reopen? Having access to these types of facilities is essential to some individuals and their mental and physical health.
Another good question. And we are developing guidance for some places have closed down when we didn't order them closed. And they are now thinking about how they can safely provide service to people. I think you will find that we will provide that guidance. So things like making sure they have enhanced cleaning, they take steps to make that people don't expose others. I think those are exactly the kind of guidelines that we will be putting in place as we start to lift some of the restrictions. And I think we can do that. I think people will be able to resume some activities and do so in a way that minimizes the risk that they might be exposed to COVID-19.
We all look forward to that.
Yes, we do.
So we're coming close to the end here, and I have the opportunity to ask a question. So I'll take my opportunity to pose the question now. And it could be to both of you, Dr. Daly or CEO Mary. And the question is this. We now have to maintain social distance, and it's become part of how we have to live. And I'm wondering if each of you have come across any interesting ways that people have been able to stay connected and yet maintain social distance. If you have any recommendations on interesting ways of doing this that you've come across.
Well, I would, going with the theme of seniors, certainly in my own personal circumstances, because I have an elderly mother, 91, down in Seattle, so I can't even see her because I can't go across the border. And so the ability to use virtual like Zoom, like what we're doing now with the whole family around her, has been extraordinarily successful. And I would say she's prone to depression. I would say because we made such an effort to try to virtually connect with her every day, sometimes twice a day. We have a little rota for our family as to who's to connect and when, that her spirits are better than I've seen for a very long time. So, well, until you know what a virtual world is like, and I think we're all learning that, you kind of think, oh, it can never be as good as face-to-face. And so, of course, it doesn't substitute in every way. But I think whether it's with family or what we found in the workplace, it will be a whole different world out there. And I think we've learned a lot through this crisis and how we can connect even without being face to face.
Yeah, no doubt. Everyone's learned all about Zoom now.
Yeah.
Yeah.
How about you, Patty?
Yeah, I had the same. I had my niece had her birthday on last Sunday, and we had a Zoom party, and she was able to connect with relatives. She lives in Toronto, from Vancouver to Toronto to Germany. And that wouldn't have happened, I don't think, if we hadn't adopted this technology. I also ran into a colleague, another physician who his elderly parents live nearby, and he goes and they come out in their balcony, and he's been connecting with them from outside so they can actually see him. And I think we've heard of people doing that for their relatives who are seniors that they don't want to get too close to. But I do think the virtual technology, we actually knew before this crisis that, for example, for some patients with dementia or cognitive impairment, that being able to FaceTime with a family member could be very calming if they became anxious in a healthcare setting and they didn't have family nearby. That type of social connection, it doesn't, of course, we all want to get back to the physical connection, and that's important. But that the virtual connection can actually be a very good supplement to this for many people.
Oh, thank you so much, Mary and Dr. Daly, for your time. We really, really appreciate you sharing a moment of your evening with us and people from all over the province, but particularly those in the Vancouver Coastal Health region. We know how busy you are and are so, so grateful for the work that you do, the work that all of your staff and your teams and all of the healthcare workers across the province, all the work that they do to keep us safe and healthy. I know that here in my riding of North Vancouver Lonsdale, the neighboring ridings, North Vancouver Seymour and West Vancouver, Capilano, all across the North Shore, all the way up to the Sea to Sky, through Vancouver, out to Richmond. We're very, very fortunate to have leadership like yours helping us get through what is an incredibly unprecedented, extraordinary time for people throughout the world, not just here in British Columbia. And I also have to comment that despite how challenging it has been for individuals, I'm also continuously moved by how much our communities have come together to support each other through this. And I know that this is true not just on the North Shore where I represent. I'm sure it's true out in Richmond where MLA Yap is, and for all of us throughout the province. So thank you for joining us tonight, especially our guests and my co-host, MLA John Yap. I want to thank Health Minister Adrian Dix and Dr. Bonnie Henry for the work that they're doing. Our government has taken action and continues to work hard to support British Columbians, and I've appreciated especially the cross-partisan, all-in Team BC legislature approach. So thank you so much, John, for joining us. Now, before we wrap up, we're also going to leave you with a few additional resources, and I'm going to let MLA Yap share a few, and then I will share some as well.
Sure. Thank you, Bowinn. So for provincial support and COVID-19 information, visit the government website, which is www.gov.bc.ca/COVID-19. For seniors looking for additional support at this time, call 211 or visit the website www.bc211.ca. If you or a family member needs additional medical advice, call 811. For the latest medical updates, including case counts, prevention, risks, and testing, visit www.bccdc.ca. Bowinn, would you like to cover the rest?
Absolutely, thank you. So for the provincial health officers' orders, notices, and guidance, these are legally enforceable orders. You can visit www.gov.bc.ca/PHO guidance, and gov is spelled G-O-V, of course. Now, for non-health related information, including financial, childcare and education supports, travel, transportation, and essential service information, visit www.gov.bc.ca/COVID-19, or you can call 1-888-COVID-19. So that's 1-888-268-4319. That is active between 7:30 a.m. and 8 p.m. 7 days a week. And I understand they also provide language services at that phone number. And remember, please follow Public Health Officers Dr. Bonnie Henry's guidelines so that we can all help protect our families, our friends, and our neighbors, and ourselves. I think there's a bit more, so I'm going to let John finish it off.
Sure. Just to finish up, a reminder, stay at home unless it's essential. Maintain good hygiene, such as washing your hands for 20 seconds. Sneeze and cough into your sleeve. And remember, even though we're staying apart, let's find ways of staying connected. So we have 4 more virtual town halls coming up over the next week. If you have family and friends from different parts of the province, let them know. And if they'd like more information, to visit www.gov.bc.ca/COVID-19 townhalls, all one word. Links to these resources are now in the description below. And again, thank you for joining us this evening.
Absolutely. Stay safe, stay healthy, stay home, and have a good evening.
And on behalf of Vancouver Coastal Health, I just say thank you for all the outpouring of support by the community. We are so appreciative. It really helps keep our morale up. Thank you very, very much.
Thank you.
Take care. Bye.